Dr. Chowman. I'm one of the pharmacists at Epiphany Compounding. In this video, I will be going over how to apply topical hormone creams. Typically, when we supply it, it will come in a pump device. What you're going to want to do is wash your hands before and after applying this. Make sure that you follow the directions that are on your prescription label. What you're going to want to do if it says to apply one pump is take off the cap, depress down on the actuator, dispense one pump worth of medication, and then rub it into your skin for about a minute. If there are no directions as to where to apply it, you'll want to either choose your upper arm, your forearm, the abdominal area, your inner thigh, or the back of your knees. You want to make sure that you're applying no more than half a gram to each application site. So if it says 1 gram, you may want to apply half of that on one forearm and then half a gram on the other forearm. You'll also want to make sure that you're rotating sites every time that you apply it. That way your medication gets absorbed well and your skin does not become oversaturated with medication. You want to also make sure that you do not shower or go swimming for at least 2 hours after you apply the medication, and be conscientious of the place that you choose to apply it if you're coming in contact with any kids or pets, because the medication can be transferred to them and they may have unwanted side effects. Once you start the medication, you'll want to put a reminder in your calendar as to when you started. That will give you a good idea of when to call us for a refill. If you forget to do that, you can look through this clear view window and it shows you how much medication is left. Our medications are not temperature sensitive, so if you accidentally leave it in your car in the summer or it comes to you in the mail, you can just go ahead and let it cool off at room temperature. Make sure that once you're done applying it, you clean off the opening with an alcohol wipe. That way you make sure that there's no blockages for the next application. You want to make sure you put the cap back on, keep it in a cool, dry place, and keep it away from kids and pets. If there are any pressure changes, which can lead to air pockets in your medication, or you get the medication and no medication is coming out, what you want to do is put the cap back on, tap it against a flat surface a few times to get rid of those air pockets, and then just go ahead and pump until medication comes out. It may take 1 to 2 weeks for you to notice any effect on symptoms, and 6 to 8 weeks for consistent effects. Hormone creams are great because it does allow for more consistent dosing. It's slower absorption, but this way you're not having any peaks or dips in your effects. What you want to do if you have any questions is refer to your patient information leaflet that you should have received with your medication. Browse through our website or give one of our pharmacists a call.